My name's Heather, and me and Jessica are going to talk about disruptive, impulse control, and conduct disorders. So you may be asking, what are these? These are conditions involving problems in the self-control of emotions and behaviors which violate the rights of others and or bring the individual into significant conflict with societal norms or authority figures. We've listed below all the disorders that are under this umbrella term of disruptive, impulse control, and conduct disorders. We're going to specifically address oppositional defiant disorder and conduct disorder. So, what is oppositional defiant disorder? It's also known as ODD. It's a pattern of angry or irritated mood, argumentative or defiant behavior, or vindictiveness. It needs to be lasting at least 6 months and evidenced by at least 4 symptoms from any of the following categories. So, the categories below are angry and irritable mood, which involve losing your temper, easily annoyed or touchy, often resentful, or just really angry all the time. Argumentative or defiant behaviors, the next category, which involves often angry with authorities or argues with authority figures. For children or adolescents, this might be arguing with your teacher or your parent. Actively defy or refuse to comply with a request. So again, with a teacher, if they're asking you something, it's the child that will refuse every single time, or the child that refuses to do what the parent wants or asks them to do. Deliberately annoys others, or often blames others for his or her mistakes or behavior. The next category is vindictiveness, which is often being spiteful or vindictive at least twice within the last 6 months. So, what are physical impacts of ODD? You could see mood or behavior or attitude changes, low emotional or behavioral regulation, poor frustration tolerance, quick temperedness, or just easily angered. You're going to see these children who you say one thing wrong and they light a fire underneath you. They're easily angered and angry all the time.
So the next disorder that falls under the disruptive impulse control and conduct disorders is conduct disorder. So this is very similar to ODD, which Heather just talked about, but this one kind of takes up a notch. It's much more physical. So these are repetitive and consistent behaviors that violate the basic rights of others or violate age-appropriate societal norms or rules. And so 3 of the following criteria need to be present within the last 12 months, with one of them occurring in the last 6 months. So there's 4 different categories. The first one is aggression towards people and animals. So these people may often bully, threaten, or intimidate others, initiate physical fights, use weapons that can cause serious physical harm to others, like a gun or a knife, scissors, things like that. They've been physically cruel to people or animals. They've stolen while confronting a victim, or they've forced someone into sexual activity. The next category is destruction of property. So this is for people who have deliberately engaged in fire setting with the intention of causing serious damage, or they've deliberately destroyed others' property by things other than setting a fire. The third category is deceitfulness or theft. So if they've broken into someone's house, building or car, they often lie to obtain things or favors or to avoid obligations, and they've stolen items of non-trivial value without confronting a victim. And then the last category is serious violations of rules. So if they've stayed out at night despite their parents' rules, and this begins before they are 13 years old, if they've run away from home overnight at least twice while living with their parents or with parental figures, or if they've run away from home once without returning for a lengthy period, and then also if they're truant from school beginning before they're 13. These would fall under that category. So this behavior can cause clinically significant impairments in their social, academic, as well as occupational functioning. And then conduct disorder directly kind of goes into antisocial personality disorder. So a lot of the times people with antisocial personality disorder will have conduct disorder when they're younger. And so if the individual's 18 years or older and they don't meet that criteria for antisocial personality disorder, they could also have conduct disorder. Physical impacts of conduct disorder can be poor educational experience and increased academic failure. So if they're constantly truant from school, or they're being very physical with their classmates or people in the school. This can lead to them being suspended or expelled, which can really have a negative impact on the educational experience. Their physical and aggressive nature can cause injuries to themselves or others. It can also lead to substance abuse and addiction, as well as legal problems and incarceration. So with ODD and conduct disorder, they're very similar in the sense that people with both, they are very defiant, they have issues with authority figures, and they have a lack of emotional and behavioral regulation. However, with conduct disorder, it's much more physical and aggressive in nature, in that they're wanting to cause harm to the people around them, like destroying property, hurting animals and people, stealing. Whereas with ODD, it's just more they're having a hard time expressing themselves, and they're very agitated and angry, but they're not necessarily trying to physically or aggressively harm others around them.
So some commonly used medications is stimulants, antidepressants, mood stabilizers, anticonvulsants, and alpha-2 adrenergic receptor agonists. So this is catapris. When you think of somebody who's easily irritated or angry or always aggressive, they're going to be in that fight or flight response 24/7. So catapris really is used to help lower that blood pressure, lower that heart rate, get them in a calm, receptive mode so that they can receive treatment and so that they can be receptive and change and be functional within the occupations they want to. So some barriers to occupations, we pulled it from the OTPF4, which as occupational therapy students, this is our framework. Some of the occupations that these individuals will have barriers to is health management, ADLs, rest and sleep, education, work, play, leisure, and social participation. So you'll see limited social participation, a lack of friendships, decreased happiness, which impacts work, school, or home. It impacts enrollment status in work or school. So if you're always arguing with your boss or always defiant to what they're saying, you may get fired. If you're never doing your homework or always arguing with the teacher, you're going to end up in trouble or expelled. It could impact your relationships with family or other peers, and it's going to impact your sleep regulation and schedule. If you're always in that fight or flight response, it has physical impacts on your body. For conduct disorder, we found it really interesting that you have a lower than average IQ, and you're going to see more of that aggression, outburst, or impulse control behavior. You're going to have a lack of safety, increased self-harm, that criminal activity that's going to have destruction of the community or the environment.
So some interventions that we found for disorders that fall under the disruptive, impulse control, and conduct disorder umbrella are working on emotional regulation, so working to with these individuals on expressing their needs and wants appropriately, as well as social skills training so that they can interact with those around them more functionally. Parent education is also huge, since this does begin kind of early on in childhood for all of these disorders. So developing a structured routine with clear guidelines so that you can try to negate any of the negative behaviors from anything surprising or unexpected. Positive behavior reinforcement when they do something well so that they're more likely to repeat that behavior. And then setting and enforcing consequences when they do something bad or they react negatively in situations. Advocating for the individual is also so important with this, with teachers, with those around them. It's important to let them know skills and things that work best for them to help mitigate those negative or aggressive behaviors, and just kind of letting them know what they can do to help set them up for success so that they can be functional and do the things they need to do. Working on medication management is also important so that we can try to get some of those behaviors under control and they can have a good routine with that, and getting them involved in therapy with their peers, with family, problem solving therapy so that they can have healthy outlets and really work on those behaviors. So we found a quote, and we're not sure who the author is, but it says, occupational therapy practitioners know that hope still glimmers in the darkest hour. So with these disorders, there is a lot of dark occupations and dark behaviors. However, we know that no individual should be defined by their disorder or disease. And so as practitioners, we see that glimmer of hope in the people, and we know that we can work with them so that they can be functional and successful in the things they want and need to do.
So for advocacy, we really want to hit this home that even with a disruptive, impulse control, or conductive disorder, individuals can be functional and successful in their everyday life. As occupational therapists, we want to use medication, therapy, education, all of these resources around you to help you be successful. And that even though these disorders may have a negative connotation, we can be successful and functional within that occupation.
Thank you guys so much, and if you have any questions, let us know.